Welcome to Dr. Lee Unplugged, real insights from the cutting edge. This is a stripped down video where I share behind the scenes insights as a scientist and as a doctor on different health and wellness topics. It's raw, it's direct, unscripted, no sugarcoating, just real talk and real science. And today we're going to talk about prostate cancer. Okay, so before we talk about the prostate, which is an organ that sits right between our cheeks in men, all right, and has a critical role for reproductive health and overall health. Let me actually introduce another topic that's going to connect to prostate health in a second. And that topic is angiogenesis, all right? And I study angiogenesis in the lab, and so I want to share with you what that is. Angiogenesis sounds like a complicated term, but angio, blood vessels, genesis, how our body grows blood vessels, is a really important process for health in our body because we have 60,000 miles worth of blood vessels. And these blood vessels, your circulation, these are the highways and byways that bring the oxygen that you breathe and the nutrients that we eat to every single cell in the body, including the prostate. Now, when we need angiogenesis, our body's going to be able to deliver that to us. So, for example, if you cut yourself, fall down, scrape your knee, cut yourself in the kitchen on a knife, you'll form a scab. All right, after the bleeding stopped, you'll start forming a scab, and it'll heal. But if you ever had a scab come off too early, what do you see? You see lots of bright red stuff underneath there. That's called granulation. That is new blood vessels, angiogenesis occurring, new blood vessels growing to actually deliver oxygen and nutrients, survival factors we call them, right to heal that wound. But when you've got just enough blood vessels healing up, that's it. It'll stop. Our body basically will just shut that baby down. All right. Now, on the other hand, if there's too many blood vessels, our body can actually control those as well. We know how to our bodies know how to inhibit angiogenesis, how to cut off the blood supply when you don't want too many. That's sort of taming blood vessels in the body. Now, where are the places where that taming process occurs really powerfully? Well, occurs in your eye, right? Our eye is a crystal clear ball. We do have blood vessels in there, but they're really very, very few, and they're tightly controlled. If you had out of control blood vessels growing there, the blood vessels would bleed and you go blind. And in fact, this is what happens in some of the blinding diseases and diabetes and aging, macular degeneration. The body loses control over angiogenesis. That's not a good thing. Another place where angiogenesis is tightly controlled normally is in our joints. Guess what? Our joints don't have blood vessels. They're avascular. And that's by design because you don't want anything interfering with that joint. It's just like supposed to move really smoothly. But when you actually have blood vessels growing in there abnormally, body loses control of angiogenesis. You know what happens? Those blood vessels leak fluid. Now your joints swell, and the blood vessels also bring in inflammation, inflammatory cells that release enzymes. And you know what that is? That is arthritis. Okay. And you can wind up having joint swelling and pain and destruction of the joints. So that's another example of where the body loses control. It's normal control over angiogenesis. Now, the other place where angiogenesis is tightly controlled is in the situation of tumors. So we form cancers all the time, including in our prostate. All right. I mean, our bodies are 40 trillion cells that are copy pasting itself all the time. And so when it makes a little mistake, or has a mutation, that abnormal mistake in copy and pasting leads to a microscopic cancer. Happens all the time. Children, adults, most of the time, we'll never notice it. It's like a pimple that forms on your back. Maybe somebody else behind you will notice it, but you'll never know it. And then the body takes care of it all by itself. And this is actually how we're beginning to reconceptualize, have a new understanding of cancer in the body. It's not like we were just hit with a javelin one day. No, we're forming cancers all the time. And our body, our immune system, and our body's ability to block the blood supply to growing cancers are really, really powerful for our health. Now, all cancers, including prostate cancer, start as these microscopic tumors. And because they don't have a blood supply when they start, they can't get bigger than about 2 to 3 millimeters in diameter. You know how small that is? That's like the tip of a pencil tip, all right? Or maybe a small grain of rice, the tip of half of a grain of rice, all right? And without a blood supply, no angiogenesis, cancers can't grow, right? They need oxygen, they need nutrients, no blood vessels, no nutrients, no oxygen. That's about as big as they can actually get, all right? Then what happens, and our body can do that, it can actually prevent angiogenesis from happening. And then what does the body do? Their immune system is conducting surveillance, swings by, sees that microscopic cancer. Aha, I see it. And then your immune system takes it out. And now you've gotten this microscopic cancer that's eliminated. And so it's not dangerous at all. So cancers can't grow without angiogenesis. But sometimes these microscopic cancers are sneaky, all right? And they find a way to stimulate and grow their own blood supply. They kind of hijack your body's blood supply in order to be able to feed themselves.
Hey there, check this out. I've got a special resource on the 5 science-based ways to lose fat that I made just for you, and it's free. Many of us want to lose weight for our own reasons, but I'm here to tell you that there's an even better reason to lose harmful excess visceral fat for your health. And guess what? In this resource, I share the 5 things that anyone can do to lose harmful excess body fat. All you have to do is click the link below to access the resource. Now, back to the video.
Now, let me tell you how powerful this is. In the lab I trained at, there was a classic experiment, all right, that looked at the relationship between tumors and blood vessels and just how powerful blood supply is to cancer growth. What the lab found, the research found, is that if you actually kept a small microscopic cancer isolated from a blood supply, no blood vessels, all right, no oxygen, no nutrients, it pretty much stay there forever, like at that size, just couldn't get any bigger. But if you allowed blood vessels to grow up towards and touch that tumor, guess what? Bringing oxygen and nutrients, that cancer, that tumor would explode in size. It would grow 16,000 times in size just in 2 weeks. All right, so angiogenesis is a powerful, explosive growth engine, and that's why our body's defense against cancer is anti-angiogenesis. It knows how to cut off the blood supply to cancers. Now, it knows how to grow them where you need it, like if you have a wound, but it can also cut it off, cut off the blood supply where it's dangerous. It's sometimes, however, all right, when you actually get clinical cancers, that's where the body generally has lost control over this system, and now blood vessels are growing and feeding the cancer. And what researchers are trying to do is to figure out how to regain control. All right, get these cancer cells out of the cockpit so you can take control of the stick again. All right, in order to be able to get those cancers starved by cutting off the blood supply. It's anti-angiogenesis. Give a TED talk on it at one point if you want to hear all about tumor angiogenesis. All right. Now, here's the thing. Prostate. The prostate needs a blood supply, just like every organ. And prostate cancers can form over the course of a lifetime. In fact, these microscopic cancers are forming all the time, as I mentioned to you. But autopsy studies have shown that 50% of the men between the ages of 50 and 60 years old, so that's you, or if you know somebody between the ages of 50 and 60, half of you, all right, half the people your age already have microscopic prostate cancers. Most of them will never become a problem for you, okay? You're not going to need chemo. You're not going to need surgery. Most of them are not going to become a serious problem for you, life-threatening problem, because the body, including the prostate, can cut off the blood supply and prevent it from taking off, all right? That is the body's ability to stop tumor angiogenesis. So I just gave you a little peek at some new biology that we're beginning to understand is so critical for cancer prevention, okay? Now, we can treat cancer by cutting off the blood supply. That's work that my organization, the Angiogenesis Foundation, has been involved with for the last 30 years. But treatments to stop angiogenesis are not as good as foods that can stop angiogenesis to prevent the cancer from growing in the first place. All right. Now, some of the work we did in the early days was to just find a way to cut off the blood supply to tumors. There was a lot of efforts that happened in the 1990s and early 2000s. Lots of drugs, pills, infusions, gene therapies, lots of exciting different ways of doing it. And finally, there was a treatment called Avastin, bevacizumab, that broke the glass ceiling, introduced a brand new way of starving cancer by cutting off the blood supply that became a landmark in modern medical history. That was in 2004 that the FDA, the US FDA, approved it, and it's used to treat colon cancer. All right. So in addition to all the other cancer treatments that are out there, you can cut off the blood supply to cancer. All right. Now, prostate cancer tends to be slow growing in many cases, not all cases, but it's also related to angiogenesis. And in fact, research has shown that the more aggressive the prostate cancers, the more blood vessels that are there. So aggressive prostate cancers tend to have aggressive angiogenesis, which makes sense, right? You're bringing more oxygen, more nutrients, more survival factors to prostate cancer cells. They're going to take off a lot faster as well. Remember, I told you, without a blood supply, microscopic cancers are stuck. Once you touch that tumor, they'll explode in size. In fact, in prostate cancer research, what was found is that the more number of microvessels, blood vessels you see under the microscope when you do a biopsy of prostate cancer, the worse the prognosis is. All right, meaning that you got a more aggressive type of cancer. So the question is, what can you do with food as medicine? All right, and I will tell you that there are foods that have natural bioactives. These are natural chemicals that can cut off the blood supply to tumors. All right, and there's clinical evidence that show that this works. The best example, I think, is a substance called lycopene. Lycopene is a carotenoid. It's found in watermelons, found in tomatoes. It's found in guava, papaya. All right. And lycopene is anti-angiogenic, means it cut off the blood supply to tumors. It won't starve your heart. It won't starve your wound healing. All right. Your body knows how to actually get all that stuff to happen the right way. But if you actually have a tumor, the lycopene will cut off that tumor angiogenesis. In fact, a study of 49,000 men showed that those who ate more cooked tomatoes, this is over about 25 years or so, had a lower risk of developing prostate cancer by 29%. All right. And the lycopene cut off the blood supply. And in fact, when the people in that study who did go on to develop prostate cancer, right, when they did the biopsy, the fewer the blood vessels that were in the biopsy specimen, turned out those are the people who actually ate more tomatoes as well. How much tomato do you need to eat? Well, the clinical study showed to get this lowered risk about almost 30%. These were men that were eating cooked tomatoes 2 to 3 times a week. All right. That's not very often, and not very much tomatoes each time either. So this is cooked tomatoes. Let's call it tomato sauce. Each serving that these men had 2 to 3 times a week was only half a cup each time. That's a serving. Now, if I invited you to my house to have some pasta and I only gave you half a cup of tomato sauce, you'd ask me for some more. You'd say, hey, Dr. Lee, can I have a little bit more sauce? I'd give it to you, because the more research has shown that the more cooked tomatoes you have, the more anti-angiogenic benefits you have when it comes to prostate cancer as well. All right. But it's not just lycopene. There are also other foods that also have been shown to be beneficial. Turns out that tree nuts, all right, walnuts, pecans, almonds, cashews, pistachios, macadamias, all right, they all contain another substance that are the plant version of omega-3 fatty acids. The plant version is ALA. The body will convert it to omega-3s. Guess what? Omega-3s, once it's converted in your body from eating nuts, also are anti-angiogenic to cut off the blood supply to cancers, all right, including prostate cancer. In fact, a study of 1,253 men in Canada showed that those men who ate 1 serving of tree nuts every day had a 31% reduced risk of developing clinical prostate cancer as well. All right. So that's kind of a preventative piece of data. It's a correlation, but it actually shows you that the stuff in our food, when we eat it, helps our body's health defenses overcome some of these diseases, including tumor angiogenesis. And in fact, another study of 340 men, so a smaller study, showed that there was a lower risk of prostate cancer in men who had high consumption of foods containing another bioactive called ferulic acid. That's Ferulic, ferulic. All right. Now, what foods contain ferulic acid? Eggplant, spinach, beets. All right. And also they found that men who consumed high amounts of caffeic acid. Where do you get caffeic acid? Well, you can maybe tell from the sound of caffeic acid. It's found in coffee. All right. Spinach, beets, eggplant, coffee. All right. Guess what? Ferulic acid and caffeic acid are all angiogenesis inhibitors, all anti-angiogenic. They cut off the blood supply to cancer as well. All right. So we started off by talking about lycopene. So I told you that tomatoes have lycopene, watermelon has lycopene, these things that kind of have this red hue to their flesh. Guava, pink grapefruit also has some lycopene in it as well. So look for the pink, look for the red. Okay. Those are great ways of getting lycopene. By the way, lycopene is also an antioxidant, protects you from, protects your DNA from damage from environment. For example, like ultraviolet radiation. Think about sunburn or sun exposure at the beach. All right. So the question is diet a reasonable way to prevent, slow prostate cancer, or maybe both? And the answer is yes, a healthy diet that contains foods with lycopene, ferulic acid, caffeic acid, omega-3s, all right? You're talking about seafood. You're talking about nuts and legumes. You're talking about tomatoes. Sounds an awful lot like the things that are in the Mediterranean diet, and it turns out a healthy diet that contains foods containing these bioactives actually amplify your body's natural anti-angiogenic, cancer-starving systems, and it can actually slow down and prevent prostate cancer growth. Now, there's food as medicine for prevention, but what if you actually have prostate cancer and you're getting treated? Maybe with androgen treatment, maybe with radiation, maybe with beads, all right? Maybe with surgery, all right? Here's the thing. You should think about using diet as a way of enhancing your chances of overcoming that disease, right? Don't just leave healthcare to the doctor. Actually, that's called sick care when you go to the doctor's office or the operating room. Healthcare is what you do at home. So if you got prostate cancer, whatever the kind of treatment you're getting, you should be eating these other foods that can amplify your body's health defenses while you're getting treatment. That's called food and medicine. There's food as medicine prevention, food and medicine to amplify treatment as well. Okay.
Hey there. If you're ready to take control of your health using the power of food, then I encourage you to check out my Eat to Beat Disease online course. More than 4,000 people from 80 countries have taken it, and now they know how to eat to beat disease. And you can too. I personally developed all the material in this course, drawing from my latest research and my years of experience. It's designed to give you practical, science-based strategies that you can use to boost your health every single day. To learn more, click the link below.
Now, here are some other foods that can inhibit angiogenesis and have been shown to have substances that directly kill prostate cancer cells. All right. This is mostly lab research, but check it out. What are the foods I'm talking about? Celery, oregano, okay? Capers, love capers. Apples. Apple a day keeps the doctor away, right? Here's another reason to like apples. They all have natural compounds shown in the lab that can kill prostate cancer cells. The other foods that are actually beneficial against prostate cancer are foods that actually have a lot of dietary fiber. Now, why is that important? Because dietary fiber feeds our gut microbiome. These are the 39 trillion healthy bacteria. You've heard of good gut health. They live in the colon, way down, all right? But when you feed them dietary fiber, the fiber feeds the bacteria. So think about your gut bacteria like pets. If you got a pet dog, pet cat, pet bird, pet goldfish, you make sure you're feeding them every day, right? So we should be feeding our microbiome, our pet bacteria, every single day with dietary fiber. And when we do that and we feed the microbiome and they're well fed, they pay us back by releasing substances called short-chain fatty acids that lower inflammation. When inflammation is lowered, that actually tips the odds in your favor against cancer, because cancer loves inflammation. So if you want to have an anti-cancer effect, lower inflammation in the body, eating foods with dietary fiber is a great way to do it. Now, the other thing I told you is that, DNA, when it's mutated, can set you up for cancer. There's little mutations that can occur. So eating foods that are antioxidants can also be incredibly beneficial, right? So they say eat the rainbow, colors of the rainbow, the red bell peppers, the berries, all those colorful foods, the strawberries, the blueberries, the blackberries, the greens. A lot of people say, it's just leafy greens. Nope. Think about the shades of green that you can find in the grocery store. It's a myriad of green. If you had to paint your a room in your house color green, and you went to not the paint store, but you went to the produce market, you'd have a hard time deciding which color green you would actually want to choose from. That's the diversity of colors there. They all contain antioxidants that lower inflammation, protect your DNA, and are anti-angiogenic. All right. Now, finally, foods that actually can directly support the immune system can protect against prostate cancer as well. So what are some immune boosting foods that activate your immune cells? And remember, I told you the immune system conducts surveillance, and your immune system naturally is hardwired to try to wipe out cancer cells, even if you've got very advanced cancer, very advanced prostate cancer. So whether you have microscopic cancer or advanced cancer, you want your immune system to be as strong as possible. So what are some of the foods that have been shown to boost your own immune system in a way that could tip your odds in favor of fighting cancer? Mushrooms. Mushrooms contain beta-D-glucan, which actually fights, which is anti-angiogenic, and also boosts immunity. Broccoli sprouts have been shown powerfully to boost immune function. Extra virgin olive oil can also boost immune function. And pomegranates, whether you have the seeds, which I love, put them in a salad, you can cook with them, or pomegranate juice. Just don't drink too much of it. Make sure it's pure and it's not cut with other sweeteners. But it's very, very sweet. So just a cup a day is enough. That's been shown to actually lower the rise of PSA, which is a prostate cancer marker. Now, I've talked a lot about food, but you know that food isn't enough for health, right? You want things like exercise as well. It turns out that exercise can slow the growth of prostate cancer. And I'll tell you why that is. Exercise has a lot of benefits, all right, and including general protection against cancer, including prostate cancer. And we think that this is partly due to the fact that when you exercise, you're stimulating the body to lower inflammation. Now, let me give you a little nuance to that. When you're exercising and working out, actually you raise inflammation in your body, but just for a short period of time, right? So because what you're doing when you're really working out is you're ripping the muscles. That's how you grow more muscles and stay in shape. You kind of stress out your muscles. That causes a little inflammation. But we think that once you start that inflammatory reaction to acute exercise, the body rears up and then sends out anti-inflammatory signals to lower it afterwards. So when you're exercising, you're actually working your muscles and stimulating them, maybe tearing them a little bit. Then they have to be repaired. Well, then the body surges anti-inflammation, and that can actually be beneficial as well. By the way, anything that can cause inflammation can set you at a higher risk for cancer. For example, environmental toxins, drinking too much alcohol, smoking. These are all risk factors for prostate and other cancers as well. So one of the things I've been telling you is that you want to eat the right foods, eat healthy foods, colorful foods, foods with dietary fiber. You want to have regular exercise. By the way, if you don't actually want to work out, join a gym, get a trainer,